Hi, everyone. My name is Paige Quintero, MD, and at the request of several friends and loved ones, they've asked me to talk about the coronavirus and what we can do to stop the spread. So, coronavirus, COVID-19 as we're calling it, is a new threat in America. It came from China and it spread internationally, and now we're spreading it between each other in America and many other countries. And it's going to be a big deal. Some folks have said, oh, it's just like influenza. No, it's not just like influenza, although I do have a graph we're going to talk about that shows some of the similarities, but it's probably going to be about 30 times more lethal than influenza has been. And although there have been more deaths from the flu, that's just because it has been more common. But it's a rising health threat, a pestilence, as the Bible might call it, and we need to work together to see if we can stop the spread. So, 100 years ago, 1918, the Spanish influenza devastated the world. There were millions of deaths. They didn't even know what a virus was. They called it influenza, which is Italian for influence, but they didn't know what it was. They found out later. But you can see on this graph the tale of two cities. Philadelphia is in the unbroken line, and St. Louis is in the dashed line. In Philadelphia, when influenza, this is a Spanish flu, broke out, they didn't do anything to stop it. They didn't know what caused it. So they just went on with their daily lives. They had a parade actually where hundreds, thousands of people came. It was a parade to celebrate the ending of World War One. And you can see in St. Louis, they had a huge spike in deaths because people were around each other and they were passing and they were coughing on each other and they didn't know what caused this. In St. Louis, however, the public health department decided that the best way to not get the virus was to quarantine yourself and to stay away from others. And so they canceled school, they closed gymnasiums, they canceled sports events, they asked churches to close. And because of this, we see a significantly lower death rate in St. Louis as compared to Philadelphia. Now, back then, they didn't have fancy terms for this. They didn't call it social distancing, but that's what it is. And that's what we're seeing in America now, and that's what's worked in other countries as this virus has taken shape and started to become a threat. I'm going to show you all a graph. This shows the exponential rise in cases in Wuhan, China. Okay, so it went up way, way, way high, and now it is falling. About right here to right there, January 22, 23, they've they've shut down everything, okay? In true communist fashion, and I hope they don't come after me for saying this on the internet, but they shut down schools. You weren't allowed to leave your house unless you were an essential healthcare worker. They shut everything down forcibly. But in 12 days, we see that the virus has started to slow down. Now, there is a lag time here. You do see this orange part of the graph. They're still diagnosing cases, and this just kind of shows the lag time between when you find out you're infected and when you actually got infected, which was 7 to 10 days earlier. But this graph is starting to come down too, and I'm sorry it doesn't go out past February. But there's a nationwide mandatory extended holiday. You know, it's Lunar New Year. People are not celebrating this because they knew that if they didn't do this, this virus was going to continue to rise exponentially and exact even more of a death toll than it already had. So when Wuhan did this, they started to see the turning point. I think a few days ago, they only had 12 new cases, which was a big deal. This is because of something called R naught. It's not R0, you say it R naught, and this describes a replication of the virus. So R naught is how many people one infected patient would infect. If I have the virus, and I might, because 7 to 10 days before you feel any symptoms, and some people may not get sick at all. So I'm just kind of treating this like, hey, let's pretend like I have it. That way I'll be careful and not infect other people. If I had the virus and I infected exactly one other person, that's an R naught of 1. In an R naught of 1, a pandemic is stable. It neither increases or decreases. One person only infects one other person. If two of us had the coronavirus, but we only infected one person between the two of us, that's 1 divided by 2, that's 0.5. The R naught would be 0.5. A pandemic dies out when the R naught is less than 1. In China, their R naught started 2 to 3. Now it's approaching less than 1, and you see that the pandemic is dying out. If the R naught is greater than 1, the pandemic will spread. In China, it started between 2 and 3. In Italy, where they've got a horrible health crisis, the R naught is between 2 and 3. In America, the R naught is between 2 and 3 right now. Every 2 to 3 days, we're going to see our cases double, and that's what we're seeing. That's a exponential rise. What can we do to decrease the R naught? Well, if we had a vaccine, that would be great. That would keep people from getting the virus. We don't have one. It may be up to a year away. So here we are in a population that has no immunity for this virus. We're sitting ducks. If we had a drug that could treat it before people could spread it, that would be great. That would decrease the R naught, but we don't really have that right now. We do have a promising HIV medicine, but it's not widely available, and it's still being studied. If we employ something called social distancing, where we don't go to school, we don't go to church, we don't get in large crowds, we cancel the NCAA tournament, that will decrease the R naught. And we've known this for 100 years, from the Spanish influenza epidemic in America, the tale of two cities, St. Louis versus Philadelphia. We have seen this in China during this pandemic, where they forced people to not be around each other, and their death rate started to fall, and their infection rate started to fall. In America, I think this is probably going to have to be somewhat mandated by government, but a lot voluntary at this time. We are a little bit behind the 8 ball. They did this early in some Asian countries like South Korea and in Singapore, I believe they did really well. China caught on pretty soon. Italy did not, and right now they're having a disaster of epic proportions over there. They've got more people sick than they have ventilators to treat them, and then they have healthcare personnel to treat them. So we don't want that to happen here. My sincere hope is that we can all do our part to, as they say, flatten the curve. This is a graph that talks about flattening the curve. So here is what's going on right now. We have an exponential rise in cases, and above this dashed line is where we have more sick people than we have doctors, nurses, masks, ventilators to take care of them. This is where we start to have deaths and deaths that could have been prevented. People that we could have saved, but we just didn't have enough resources to do it. If we could start distancing ourselves from others, and I don't just mean washing your hands and disinfecting things, and that's important, but I mean not being around other people. If I had coronavirus, if I'm not around to sneeze on you or cough on you, then I'm not going to give it to you. I'm at home. I'm keeping it to myself. And again, there's a 7 to 10 day incubation period. You may have it for 7 to 10 days and be contagious and not even know it. So if we will stay away from each other, then the graph will look like this. Yeah, we're still going to have a lot of cases, but we'll be able to spread it out, and it'll be slow enough that we can deal with it. And so we can actually have enough doctors, nurses, ventilators, masks, all these different things to deal with the disease. I can't tell anybody what to do, but I hope that we all consider some of the simple things we can do to stem the spread of this virus. It is a great hardship for my family not to go to church. My children really don't understand yet. They're not going to be happy tomorrow when we don't go to Sunday school and we don't sing and we don't go to worship. But for our family, the sacrifice of 3 to 4 weeks of being off church is going to pay off in seeing this virus slow down. It's going to be a sacrifice for children to be off school. I guess they're home and they eat a lot of snacks and they're just kind of underfed all the time, but that's okay. Children aren't getting terribly sick from this virus. To my knowledge, there's no reported deaths in any child under age 9 from the last data that I've seen, but they're very good at spreading viruses and colds and diseases and ear infections and all this. We know that. So this is why we don't have school, because we may have a lot of asymptomatic children that are infected who are infecting each other, and these people are taking it home to parents and grandparents and other loved ones. So that's all I have to say. Be safe out there. And as they say in the book of James, wash your hands.